God in the cloud. Okay, well, hello everybody. Welcome to the Healthy Joint, Healthy Lifestyle Show. My name is Dr. Aminola Dada. If you're in the greater Seattle area, I practice medicine, help people with joint pain become pain-free, and people with autoimmune disease get their immune system back on track. I have a treat for you today. I have the one and only Dr. Heather Stanley, who has an amazing practice. She is how many board certifications do you have, Dr. Heather? She is the CEO and physician at Unity Maternal Fetal Medicine. She's in Orlando, Florida, right in the backyard of Disneyland. And you can tell by when you come to a clinic, you'll find her to be one of the most educated physicians, triple board certified with 25 years of experience. She treats high risk OB. And so what I mean by that is if you're a pregnant woman and there's some concerns about pregnancy, Dr. Heather Stanley is a person who you go to meet. She takes each person and pregnancy as a unique entity, and she will begin by taking rather a 360 view and assess the woman and her baby. She will craft an individual plan to give you and guide you towards the best outcome for you and your baby. Dr. Stanley Christian, thank you for coming to the show.
Thank you. I was like, who she's talking about? Thank you so much.
I am talking about the phenomenal Dr. Heather Stanley Christian. So today, because we have this amazing guest, right? We are going to talk about pregnant women and why they may need to see a high risk OB, why they may need to see someone like Dr. Heather Stanley Christian. So Dr. Heather Stanley Christian, please tell us a little bit about yourself and why you do what you do.
Thank you. Thank you for that awesome introduction. So as Dr. Dada says, I look at pregnancy, women with pregnancy, and any condition that might adversely affect the mother or the fetus during pregnancy. Our specialty is unique because we don't have just one patient, we have two. And we have an unseen patient, which sometimes we have to use some tricks of the trade to assess the unseen second patient, which is a fetus. I've always wanted to do some kind of medicine since I was 10. Actually, I think I had said neurosurgery. I was 10, so clearly I didn't know what I was talking about. But I have always been drawn to medicine. Come to find out that my dad's mother, so my paternal grandmother, was a midwife. And in thinking back in my exposure, I remember my dad having a book of medicine, which I always used to read whenever I could. Actually, there's a picture of a cancer of the tongue, and I was a thumbsucker. My mother used that picture to scare the living daylights out of me because I went to her and I was like, what is this and what causes this? And my mother, without batting an eyelid, said, that's what you get when you suck your thumb. You see how mean my mom was?
Well, you know what I take away from that? She is quick as a whip. She is fast on her feet. She's like, I've been trying to get this girl to stop sucking her tongue, and I got it, right? Boom. She did not even like miss a bit.
No, but that night, I wanted to suck my thumb, but I was so scared. But mission accomplished.
Yeah, she handled business. She took care of business.
She did take care of business. So that whole thing was way back in the day, and it never really wavered. As I went through high school, I tracked in science and ended up doing a master's in biochemical pharmacology because at that time I really wasn't sure if I wanted to do research or clinical. Well, after working at SmithKline and Beach I think they've changed the name a million times. I was done with that. I was like, that's too boring for me to have to spend years and years and years to come up with stuff that may or may not work. So I tracked into clinical and went to med school, and here we are.
Fantastic, fantastic. Yeah, I love that story. I know in today's day, like your mom Bianca in all kinds of trouble. Back in the day,
Yeah, back in
that's
the
how you handle business. Well, yeah.
yeah.
So thank you a little bit for kind of giving us a little insight about kind of how you became who you are, the superpower that you are, and so, so one of the things I think, would be nice to kind of bring it all home is if you could tell us a story about when you've helped a pregnant woman with kind of a unique and kind of unexpected, which I'm sure that's your daily life, right? A
Is
unique, exactly, by the time they're coming to you, something is up, right? And I like the way you said you have two, I hadn't thought about it that way. You have two patients, you know.
I
Yeah.
do.
So tell us about a time when you had a patient, when you helped a patient with a unique and unexpected health challenge during her pregnancy and how you were able to support her through this and maybe when the outcome.
All right. So, because I have two patients, so there's an unexpected in the fetus, which is devastating because when you're doing that ultrasound, so that's how we see our unborn patient. There is, and it's hard to kind of pick one out. So maybe I'll just say the avatar of the unexpected fetal anomaly, which I was able to diagnose in utero. So, my other side gig is a clinical geneticist. So, you see a problem like this one particular one. This baby had what was called a congenital diaphragmatic hernia, which meant that the stomach was displaced up into the chest, which displaced the heart, which causes a problem for the lung development.
Yes.
Well, looking at that, that was a problem. But then looking at mom, she had some physical features.
Oh.
Then she had a son that was with her who also had some physical features. And I was able to diagnose, inform the family, but also make a diagnosis in the mom so that her risk factor of having another child with this disease and give her a 50% risk. So that's the one example of where the diagnosis in the fetus caused us to look at the mom and the brother and give a diagnosis of a very rare genetic condition.
Wow.
And counsel her as to what the risk was to the future pregnancy, which was 50%.
Wow.
With pregnancy.
Wow. And important because if that was undiagnosed in her son, probably has some clinical consequences for him. So you may even have saved his life too in the process.
I would like, yeah.
Yeah. Well, I'll say it for you. Don't worry. I'll say it right now. That's amazing, right?
But,
So,
as a mother, when you see a
yeah.
child with certain things, and that was the first thing I looked at her like. But then as I got to talk to her, she had some intellectual disability. So it was really her mother that was kind of filling in the gaps. And I had to tell grandma, I was like, this little 3-year-old baby something's not right here. So let's sit down and figure it out. So I did the genetic test, confirmed it.
Wow,
Yeah.
that's amazing. So my next question is, have you worked with pregnant women in a particularly complicated condition that's kind of more associated with autoimmune diseases?
Oh, yes. Oh, yes. That's our bread and butter.
Yeah.
I've seen first trimester with lupus nephritis, with maternal ascites.
Whoa.
Yes.
So
And
lupus nephritis, let me just help out, is lupus, when your immune system is overzealous and attacks different parts of your body. Lupus is the most common one people talk about, can affect everything from your head to your tippy toes. But so Dr. Stanley Christian is talking about a patient who had lupus that affected the kidneys, lupus nephritis, and then had ascites, which had a lot of fluid buildup because I'm assuming the kidneys weren't working too well. Then I'm going to let you continue.
yes, when she first met and we first did that ultrasound, is exactly the case. She we worked very hard together, a combination of diet. She really didn't want to be on too many medications, but we were able to help reverse the process. And I will tell your listeners that it takes a team. It's not just your doctor.
Yeah.
It's you and your doctor in an area of shared decision making, shared discussion of the risks, the benefits, the alternatives. Anyway, she was able to get to 34, 35 weeks without any problems.
Yeah. Yeah.
On the other hand, I've seen people with lupus who came in with mycophenolate, which is those drugs to suppress,
Yeah.
who unfortunately did not stop the medications in time.
Wow.
And that is one of the few medications that can cause a lot of malformations in babies.
Yeah. Yeah.
Yeah.
Yeah.
That,
Cellcept, yeah, you can't take mycophenolate or Cellcept during pregnancy. So
correct.
tell me, I would tell you this. So from a rheumatologist, I know we joke about this all the time. That from a rheumatologist standpoint, right? I'd like to treat one person at a time, right? And so when they come pregnant, or they even start to talk, especially when they already have an autoimmune disease, and they start to talk to me about their pregnancy, I immediately look for Dr. Heather Stanley's number. so so from my standpoint, right, is how knowing the theory about the things that can happen, it generates a little bit of concern. And so I really try to be proactive with my patients. If you have lupus or an autoimmune disease, I want you, even, and you're talking about pregnancy, I want you to go check in with high risk maternal fetal medicine specialists and just say hi. Hi, I'm here, and then once they get pregnant, and I don't know if you actually, I don't know, how soon do you want to see them? Is it after the first pregnancy test? Is it
No,
first trimester? When do you want to see them?
if they have the diagnosis and they are contemplating pregnancy, if they're even having a thought about having that uterus occupied, that is actually the best time. The studies have shown that women who are in remission tend to fare better in pregnancy than those that are in active disease status. So all things being equal, because sometimes, we don't plan and things happen, but all things being equal, having that conversation with a maternal fetal medicine specialist, because one of the biggest things we want to do is to look at the medication, see what you're on, what you need to be off, how long you need to be off of it. Because mycophenolate, I believe you need to be off of it for a couple weeks before you even attempt conception. So it's a good idea to check in with us for medication. Then what to expect. If you have a flare, what are the safer medications?
Yeah.
You use the biologics, which biologics work well. What are the complications? What to expect after delivery? Can you breastfeed with the medications that you're on? Some lupus patients have other the antibodies that can actually the SSA and the SSB that can actually block the baby's cardiac conduction system and cause heart block, so that in the four chambers of the heart, the upper part, it doesn't send electrical impulses down to the bottom part, and those babies need pacemakers at birth. So there's a plethora of things that we need to have a conversation about, not necessarily to scare you out of pregnancy, but just to have a plan.
And that's so important, right? So when you're talking about people with lupus, or even sometimes now old people with Sjogren's that have that antibody, SSA, SSB, you're right, it can cross the placenta and cause heart block in the baby. But that's why we keep you kind of in close contact with somebody, like with a doctor like Dr. Stanley Christian, because they can do ultrasounds and kind of monitor and kind of, make sure that that doesn't happen. And it looks like there are ways to treat them, right?
Yes. So, well, so the heart block in the babies, that's still undergoing a lot of data. It used to be a few years ago that they thought that prednisone, like if we did what we call PR interval assessments,
Yeah.
but the data is not really so good with the PR intervals and prednisone. What's an up and coming drug, and we're hoping to see what the data will show, is a Plaquenil.
Okay.
Um,
Okay.
so even if you have lupus patients who
Yeah.
are in remission, but they have the SSA and SSB antibodies,
Yeah.
putting Plaquenil like 200
Okay.
milligrams a day may it's showing promise as being protective
Okay.
for the fetus heart.
Okay. Okay, I love that. Yeah, because we totally believe in Plaquenil in patients with lupus as in preventing the risk of flares and risk of worsening of their condition. So, okay, well, go Plaquenil. Everybody knows hydroxychloroquine, but we won't go into that. Good. Wow. So yeah, so let me see. There's so many questions, right? About this area this area of medicine.
Bring it.
And you just make everything just sound so easy. You just don't ultrasound, you just take the PR interval, and I just want to run screaming for the roof. So thank God we have you. Thank God we have you to help our patients, right? So so besides medicines, right, how do high risk, pregnancies kind of feel? How do we get them to feel supported? Because if I'm scared, I'm sure they're scared, right?
Yeah. You know, we have to, at least for me in our practice, we remember that the unit is not just the mother and the baby, but it's the family. Today for us in our practice was just a reminder to us of medicine is more than just talking statistics and talking risk. For example, I have this is another rare case, so rare that I think she needs to go to one of those unicorn centers. And out of it, she has um, some disabilities. I don't want to be more
That's okay.
specific.
Yeah,
Yeah.
that's okay. Yeah.
Which is going to challenge her independence as a new mom.
Yeah.
And, rather than dealing in the zebra-ness of this disease that she had, we sat down, her husband was here, she was there, and we're like, okay, so we need to think about resources.
Yeah.
How are you feeling? I mean, we kind of went into are you that depressed that you're thinking about the plan? Because
Wow.
there were a lot of things. She's a young lady who sort of lost a lot of independence, but got married and just struggling with that change in her lack of independence. And now worried about how is she going to be at home alone with this child.
Mm.
So the physical visit became therapy visit. And so just figuring out in her space and in her partner space, what are the resources they thought that they needed.
Wow.
So that is my homework. Yeah.
You do a lot. That is a lot. So it's not just the mother, it's not just the baby. It is how is she going to cope? Is where she going to get the resources so that they both can thrive? What are
Yes.
the external sources of support for her? That is a huge burden. That's a lot.
And we often forget about the fathers, because with the mothers being, I don't want to say incapacitated, but they're in a space where they need a little bit more support. A lot of us, we're mothers and we're doing it all, and we doing leaps in a single bound and doing all the things. But when a mother is now becoming relatively dependent on that partner now assumes the mother and the fatherly role, and that's not always easy for them.
Yeah, that's an unexpected, right, additional. At least when you're a mom, you have 9 months to think about and prepare. But I think the father has no idea what's coming his way. Right.
No.
Yeah,
And then he has to work it. Guys tend to be problem solvers.
yeah.
So it's that I have to go to work. I have to make the money. And women kind of, we think in a different way about parenting.
Yes.
And so all that comes with that.
Yes, definitely. Yeah. Wow. Dr. Stanley Christian, you are phenomenal. And just the work that you do is so important. And just extending my gratitude just as a woman to you, just for all the and you're not doing bread and butter. You are doing, when a pregnant woman is having issues, this is who you come to, right? And so that we can have the best outcome. You have a plan, you look at them 360 degrees. How can somebody find you to work with you if they need you?
So we are on social media at Unity MFM. Our website is unitymfm.com. I am licensed in a couple of states, Florida, Missouri, and I have a lot of expired licenses around. You can always call if we don't know, if we can't help you physically. We have a good network of MFMs. Actually, one of my patients moved to North Carolina and was really angsting about MFM care. Got on an underground railroad, talked to some of the MFMs, got her linked up in North Carolina. So you can always give us a call and we'll help you figure out who for you.
Yeah. Well, I would say that if you're in Florida, I know patients of Dr. Heather Stanley Christian that have driven hours to see her. She's that good. I'm sorry, she is that good. So if you are anywhere near Disneyland, anywhere in that Orlando, even Fort Lauderdale, even Miami, you need to go see her. I'm sorry, you just need to go see her because she is phenomenal. She goes the extra mile for her patients. So I'm so glad you were able to join us today, Dr. Heather Stanley Christian. Really appreciate your insights. Thank you for the work that you do with some of our patients that have autoimmune diseases. So if you're in the Orlando, Florida area, go see her. My name is Dr. Arinola Dada. Please join us. Watch this video on the Healthy Joint Healthy Lifestyle Show on YouTube. Like it, share it, subscribe if you think it's been helpful. And thank you very much for coming to the show, Dr. Stanley Christian.
Thank you so much for inviting me. I'm truly honored to share information.
Okay, thanks everybody.
Bye. Happy holidays.
Happy holidays. Let me see if I can stop recording.